Hey everyone, Dr. Strong here from the Strong Health Institute, and what we're going to be talking about today is what is functional neurology. Now, functional neurology is the application of clinical neuroscience used to rehabilitate the nervous system and the brain. So if I had to ask you what the most important system in the body is, what would you say? That's right, the nervous system. The brain and the nervous system control everything we do. So if we have something off in the brain or in the nervous system, it can lead to issues later on, which equals symptoms. So what we can do is we can use these therapies that are in research and we apply them and we see how we can change the brain and the nervous system and make it function more optimally. Now you might be wondering what kind of issues can be helped with functional neurology. So anxiety can be helped, ADD, ADHD, concussions, stroke rehabilitation, depression, hemiplegias, learning disorders. All of these are brain-based most of the time, and we can use therapies to help rehabilitate those parts of the brain that may not be functioning as well. So if you look at this chart behind me, you can see the brain is very elaborate in how it works. So we have maps in our brain. We have maps of our body on the right side and the left side. This area of the brain is really responsible for like our anxiety and our stress centers. And then this part is responsible for like our breathing and digestion. As we go down, this is responsible for movement. So we know if there's dysfunction in one part of these areas, then we know that we're going to have issues. So what we can do is we can come in and we can use eye movement therapies, we can use movement therapies. There's really a lot of therapies that we can do to help localize and find where the problem is. Now you can come into the Strong Health Institute and we do a full neurological exam. It takes about an hour long, history, everything like that, to kind of find out where your issue might be stemming from if it's something that hasn't been resolved for a while. Now, let's say you have something like chronic pain. Chronic pain can be interpreted in the brain if there is no injury. Say that there's nothing that happened and you just constantly have pain for no obvious reason. Then it could be brain-based, and we can come in and we can look at and see if we can make a change in it. Normally, after the first hour exam, we know if we can make a change because the brain and the nervous system are so what we call plastic, and they change very rapidly. So if you have any questions, you can contact me at 931-854-9393, or you can go to my website, which is www.stronghealthinstitute.com. Have a great day.